Good morning, and welcome to our continuing series, Interviews with Disciples and Devotees. Again today, we have the honor of Dr. Pachegaonkar with us, and he will speak on a rather extensive subject, arthritis, and today beginning with osteoarthritis. Namaste, sir. Welcome. It's a huge subject, isn't it? And it affects millions of people.
Yes, yes.
So, osteoarthritis.
See, basically, arthritis means inflammation in the joint. And in human body or even any living body, even in animals, the bones provide the frame to the body. Bones provide the frame, and joints are formed with muscles, tendons, and ligaments.
Okay.
And because of these ligaments, tendons, and muscles, our movements are possible. So it is mainly these tendons of the muscles which originate in one bone and are inserted in the other bone. And contractions and relaxations of these muscles and ligaments, the movement is possible.
So the tendon goes through a bone into another bone.
Oh, no. It is
I didn't understand.
See, if there are two bones connected with each other.
Right.
So one tendon is originating in one bone, it is attached to one bone.
Attached, not in it. Attached to it.
Attached.
Okay, got it now.
So not only that, even when we examine the bones, we can make out the marks of the attachment. And in other bone, they are inserted. The muscle is inserted and attached to two different bones. And because of the contractions and relaxation of these tendons, the movement is possible. And for finer movements, even there is actually multiple ligaments there, group of ligaments.
At the joint.
At the joints. So tendons and muscles are for gross movement, and ligaments are for the finer movements. So this network, they gets inflamed. Actually, sometimes the origin or even the insertion, that area gets inflamed, and that is osteoarthritis. So this can be because of many factors together. Like if the person has some moments which are too hectic, and there is a lot of stress because of the hectic moments, then also there is inflammation. But in musculoskeletal system, one phenomena is very important, that the strength and the tone of the muscles, ligaments gives the strength in movement. The main strength of movement depends upon the tone and the strength of the muscles. Now the funniest part is, in human body, though the muscle is very strong, it has capacity to exhibit strength, but every time it is not alertly strong. As and when required, that tone is granted. So suppose I am lifting one object from this place to this place.
Okay.
Now these muscles are in action. So my central system approximately is able to judge the weight, and that much tone is granted. That much tone is granted.
Interesting.
So many times what happens, suppose I am moving, I am walking, and I am not aware of that walking. Reflexly I am walking. My body is walking. That happens in body. Sometimes many repeated actions, you don't use your alertness there. Reflexly body starts walking. And when your mind is engrossed somewhere else, then maybe that tone is not granted what is required. And therefore there is injury. because reflexly you are walking, whereas your mind is somewhere else, which judges the tone. And suppose you are walking and the ground is uneven, then you are not prepared. And therefore, the joints and muscles, they suffer the injuries while moving.
So one has to be conscious
Correct.
at every moment of the muscle.
That is ideal. So there is no chance of getting sprain or trauma or overexertion. See, you will be able to lift the weight or may not be able to lift the weight. That shouldn't matter. But sometimes, like, you are lifting the weight, but it is not you. Mentally, you are engrossed somewhere else, and your body is lifting it. Then these muscles are not prepared. So you get sprain and injuries. So such repeated sprains or injuries on the insertion or the origin of the tendons gives rise to inflammation. And then we call it arthritis.
Yes.
And so mainly, and more on the top of that, what people do is generally that when they have pain in the joint, mainly osteoarthritis affects the knee joint maximum. It affects every joint, but knee, because that's the most vulnerable joint. Because when we are walking, whole body weight has to be borne on one joint at a time. And many times ground is not like very smooth, uneven, you step on some odd place. There the trauma is more if you are not alert. But
and what about climbing up a hill
same thing, climbing up
or down?
climbing down is more vulnerable because you have to balance. So you must have observed when you are riding the horse and like galloping, while climbing up, horse is very swiftly going.
Yeah, yeah.
But while climbing down, horse is extra, cautious.
Yes, yes.
So this way, even human body has to follow it. So because of these repeated traumas and not what we call a transient maintenance of tone in the musculature, actually leads to osteoarthritis.
Briefly, what is the difference in, I know we have to go in another session on rheumatoid arthritis, but what is the basic difference in osteo and rheumatoid?
In rheumatoid arthritis, it is like an autoimmune phenomena. So there the body creates or under the delusion, body feels that there are antigens which provoke the reaction in the body. So it is like an autoimmune phenomena. That's what we call a seropositive, where rheumatoid arthritis factor is positive. There the body is reacting to its own products, considering that it is antigen. So it is an autoimmune phenomena, whereas this osteoarthritis is mainly sort of secondary to traumas, repeated traumas.
Okay. Now, we have always heard about drying up between the joints. Is that fallacy?
Oh, no, that is fallacy.
It's fallacy.
See,
I
actually,
see.
there is nothing like a fluid. Fluid is there in the joint, but that fluid is just to fill up the gap and circulate our circulation and ingredients. So beyond that, nothing like a lubricant. It is nothing like that. Actually,
I see.
when we walk, we walk only on the strength of our muscles. Unless the muscles are placid, the bones cannot rub against each other at all.
Okay.
So it's mainly the action of muscles and ligaments. Because you must have seen sometimes if person has fractured the bone. But even then, with willpower and concentration, person can walk. So it is not only on bones we walk. Bones give only the frame. We walk mainly on the muscles and ligaments. So if muscles and ligaments are strong, there would be no degenerative change.
Why is there so much knee replacement now in the world?
See, knee replacement is supposed to be the last resort where there is a damage in the structure, the bony structure of the joint beyond limit. Like it can't be reversed.
Okay.
It becomes irreversible. So that is last resort. The problem with all such interventions is, see, the bone is the deepermost organ in musculoskeletal system that gives the frame. So whenever there is an injury, body just like that doesn't allow injury to happen in deeper tissues. Body is very careful. The body is very careful. And mainly what happens, like these joints, it is not the physical structure in the joint or bony structure which is responsible for movements. It is actually network of all muscles and ligaments. So you are not replacing them. You are replacing the structure which is giving you the frame.
Okay.
So only thing is that because the bones have been damaged beyond repair, and then you can even assure the recovery of tone in the ligaments and muscles, and then replacement may work. And therefore they say the replacement works very good well for 10 years. On an average they say that 10 years can work. But we have seen some cases where body doesn't accept it. Any foreign body recognizes it and rejects it. And we have come across some cases. I have one case which I am treating. The lady had osteoarthritis severe, and conservatively it might have taken 1 year. When she was brought to me, her son himself is doctor. So when this lady was brought to me, I suggested that maybe you will have to undergo homeopathic treatment with physiotherapy for 1 year and your joints will recover, because otherwise she is very healthy. She doesn't have any other systemic illness like hypertension and diabetes. Even she is around 81 now. And when she said 1 year is too long treatment, I won't be able to sustain this pain for 1 year. I want to walk fast. And she had seen one neighbor walking within 10 days of knee replacement.
So the pain is quite severe.
Yeah. With movement pain is severe because she has to bear the whole weight on that joint.
Okay.
It is severe. So when she underwent the replacement in both the knees, and in one knee she developed infection and the sinus, and it started draining out the pus. They tried with best antibiotics and all for 3 months. It was not healing. And then the orthopedician told that no, now that joint has to be fixed now. Fixed means no movement. That is the only way out. Body has not accepted this. But this is a rare complication, they say, according to them. And then this lady remembered that I had told her that it would take 1 year. So she came after that. Then with homeopathy we started treating this lady, and slowly the sinus healed without antibiotics.
And the infection cleared up.
Infection cleared up, the joint, and she is walking about. So something like this. So knee replacement should be the last resort, not really.
Right.
Now with arthroscopy, they say that it is very easy to replace the knee with robotic surgery. It is easy, but body doesn't accept it easily. Every body doesn't accept it.
But they do kidney replacement, heart replacement now.
Yes, but that is again different because they are vital organs.
Okay.
If you don't replace it or if you don't cure it within certain time, the life is in danger.
Right.
Not with knee pain.
Okay.
So here there is nothing like that. So that type of easy intervention is not warranted in knee replacement. Even if it takes 1 year to cure it completely conservatively, nothing wrong in that.
Now, Mother and Sri Aurobindo, especially I've read a lot from Mother, speaking about how the body is mostly unconscious, not very aware. It has a tamasic nature, and the vital determines things. But you are saying now that the body, in certain areas, is very conscious.
Yes. Rather, the pain is indicator of body awareness. Because if there is certain trauma and there is inflammation or injury, body develops inflammation, which is essentially the rousing of defensive mechanism. And as a result of this defensive mechanism and repair going on there is pain. And therefore we suggest not to take painkillers. Because painkillers means you are just inhibiting the defensive phenomena.
Well, this I have to ask you about in detail, because if I have a severe headache, in 15 minutes with Advil, it's gone, and I'm out of pain. What is the other solution?
See, what happens, what we call active cure and passive cure.
Okay.
Here, like you take a pill, which is painkiller, and here the pain is only in some part of your head, whatever, like concerned part of your head, you have pain. But this painkiller pill will work at the pain feeling center. So pain anywhere in the system, wherever it is even required or physiological, that also will go, first thing. Second thing is, your system is getting headache because of some aberration or some odd phenomena going on in the body. Body wants what we call imposed hibernation. Like example I'll take you. Suppose I have done sort of a night watching. I couldn't sleep well because of some hectic work for 2-3 days. And I am not eating regularly or not maintaining myself. You develop headache as a reaction to that. Now, when you develop headache, definitely you are distracted from the work.
Yes.
The hibernation or the rest is imposed upon you because you just can't work. So there, another example I'll tell you. Suppose there is a lot of congestion into the head because of, say, raised blood pressure or whatever. And headache is an indicator that there is something wrong. So you will be forced to slow down your work, hibernate. But if you take a pill for a headache, you won't have headache, you will just be more vulnerable. You will go on working. And then maybe you will end up in some cerebral hemorrhage. So we should take headache as a warning that there is something wrong and that has to be resolved by our system. When you take a pill and suppress it, that means your system is not actively overcoming it. It is a passive role. Whereas if your system realizes that you are constipated and therefore you are getting headache, you have hyperacidity and you are getting headache, or you have migraine-like movements in the brain where you need to rest.
What about a severe cold, where your body is in some pain and headache?
Yes, in severe cold also the toxicity, because what happens, severe cold, mainly it is because of the viral infections and allergy. But again, these viral infections also are secondary. Because your immunity is down, the virus thrives. So there you have to just overcome the reason, what the background which is giving rise to cold. You can't just go on taking antihistaminics and suppress the viral infections like that.
So I think that's a subject for another time, colds and headaches. But let's go back to osteoarthritis for a moment. Osteoarthritis, we said, is very painful. And people often take painkillers for the osteoarthritis. Because it's so painful, they don't seem to have an alternative. So,
No, actually, mainly we get maximum cases of osteoarthritis of knee joint,
Okay.
especially in aged people.
Mm-hmm.
So we have done this experiment with many people. What we ask them is, we ask them to put a kneecap. The simple wrapping around the knee joint itself gives you little bit of more awareness, body awareness,
okay.
because you have wrapped something around the knee joint. Second step we tell them is the stride, you put shorter strides. So that if you put a long stride,
Yeah.
you have to propel more and bear weight more.
Yeah.
So short stride. Second thing is, the third thing we tell is walk very slowly, not fast. And one more is, wherever there is vulnerable, like you have to cross a threshold or climb down the staircase, just hold. So walk with 3 or 4 limbs. So little bit of weight you distribute, and this we advise for 2 to 3 months. And in 2 to 3 months, like, because knee joint is such that you can't give complete rest. For your self management, you have to move, and each time you step, you are bearing full weight on one knee. So walking slowly, landing slowly, with short stride,
Okay.
with some body
Some body
awareness,
wrap,
local kneecap, and distributing weight on someone
Right.
else. So it gives a partial rest. At the same time, we advise the person to have a cycling like exercises, especially while lying down, where the knee doesn't get the load and there are some guarded movements without bearing weight. So this strengthens the ligaments. The rest also is given so that the inflammation is not worse. And we don't give painkillers for one reason. See, pain itself restricts your movement. That provokes rest. But if you don't have pain, then too you won't heed. You would just walk and you will be more vulnerable.
Okay.
So this way we have seen a case where one person here, you know the person, he is around, like, he was that time 81, 82, and he developed osteoarthritis, and they said, oh, you already, there is coronary bypass is done in you, so we don't want to take risk of knee replacement at this age and with this background. And so he was really dismayed by listening to this. Then when we suggested that why don't you maintain it properly, so definitely the osteoarthritis will be reversed. And he did follow our advice, walking slowly, walking with stick, and short strides and all. And in about 6 months now, he's walking like 1.5 to 2 kilometers without a stick also.
Okay, now the question I would have is what, in the interim, as you are beginning all of these practices, pain is still there. Pain is intense at times.
Yes, but intense.
How do you deal with it?
See, mainly what happens, pain puts you at guard. So we actually explain to the patient that if you are taking painkiller, there would be further damage in the joint. What do you prefer? Then their pain threshold, is improved, and they bear the pain. And once we counsel them that, see, for knee replacement also you are under anesthesia and therefore you experience the pain. Don't experience the pain. Otherwise, pain is something which is physiological and people bear with it. Then it's not, and that knee joint pain is not as severe as some sort of odd headaches. Only on bearing the weight and that time, especially osteoarthritis
Okay.
pains. Rheumatoid arthritis pains are different. They are even while resting.
I know. We'll talk about that next time because my father had very severe rheumatoid arthritis.
That's altogether different
and we'll
pathogenesis.
talk about that. Good. Any advice you can give to all the people who are listening to us? It would be very helpful.
All these musculoskeletal issues, and arthritis is one of them, osteoarthritis is one among them. You have to just learn to maintain the tone and strength of the muscles, ligaments, and tendons. This is the best thing. Second thing I would advise is for this musculoskeletal strength, the calcium deposition is must. And to have it efficiently, you need vitamin D3.
D3.
D3. And sun is the best source. So we suggest that every day, like 10 to 15 minutes of exposure, skin should be exposed to sun, would be enough for maintenance.
Early morning sun?
See, like 10 o'clock
10
is
o'clock.
supposed to be the best time here.
Okay.
But we don't advise 10 o'clock because it has different side effects also, because the rays are very toxic.
Yes.
And if some people develop reaction,
Yes.
sun allergy, or even it is even skin cancers.
I've had sunstroke.
Yes. So what we advise is around 8 o'clock in the morning. It is palatable. One can tolerate.
Okay.
And there also we ask them to rotate in the sun so that the skin, one part of skin is not exposed beyond 1 minute. So we ask them either to stroll for say 20 meters. You go and to and fro motions
And then turn
in
back.
sun, or if it is like osteoarthritis, person can't walk that fast, we ask them to lie down on mat and go on turning, and with head towards east, so that the eyes are more vulnerable for sun. So directly if the sun rays are going in eyes, there is a chance that you would have damage, vision would be impaired. So we advise them to lie down with the head towards east, so that the eyelids are flapping the eye, and skin is safe, and you go on rotating. That is the best way.
Just
But-
rotating in what way? Let's say you're lying down.
Lying down.
Rotating completely over or just
No,
left
you
and
can-
right?
Left and right also is fine, or up and upside down, supine or on abdomen, like that. Anyway, it helps. So this is what we advise. Then drinking water, because most of the urates and some salts, they are excreted through urine, and if the urination is not profuse or there is no flushing of kidneys properly, then these salts get deposited around the joint. Exactly what happens with the gout. The urates are deposited. So drinking ample of water, free sweating, good flushing of kidneys, that also helps in maintenance of this thing. But the best thing is awareness. If you are aware of the movements, there is no chance that your joints will have any issues. Mainly when you are unaware, then the problem comes. We have done one experiment, because they were telling what has that awareness to do with little work. Then we just suggested that 1 kilogram, the solid weight we kept on one table, and then we kept one bag having 1 kilogram weight, which was full of cotton. Like it was looking
big
huge.
bag,
And we just asked the person that this is 1 kilogram weight, because the weight is seen. And here cotton is. Can you tell how much is the weight? Relatively judge. And invariably everyone said that it is half kilo or 3/4 kilogram or something. No one could guess that it is same. The reason is that mentally they are prepared to lift a heavier weight because of the volume. So when they lift and keep it elsewhere, that is very light. And this, because the volume is small, they are not prepared, so they lift and keep and they find it heavier. So same thing happens when you are walking. Especially nowadays we are advising exercise, like for diabetes we say that you just have a 1 hour walk, say for 6 kilometers a day. Now we are advising actually go 20 steps up, go on the first floor and come down. Generally one floor is like 3 meters with 20 risers
Right.
on an average. So we ask the person to go up 3 meters and come down with the staircase. So while going up, the person is lifting oneself for by 3 meters, and while coming down, one is balancing. So
Yes.
it is lifting and balancing together, and that is supposed to be the best exercise,
Better than walking.
better than walking.
I see.
But because it's like an hurdle, and there is no monotony. In walking, what happens? There is a chance that while walking, your limbs are walking and you are somewhere else.
Very true.
Whereas this staircase, you have to be cautious.
You have to be
going up and
conscious. You
then-
have to be conscious at
Yes.
all time. How many times to walk up?
We advise around 30 minutes.
30
Like
minutes.
30 minutes. That's the best exercise, which is calorie consumption wise and awareness wise equivalent to like 60-minute walking. Yes.
How many minutes again?
30.
30
30
minutes up and down stairs.
Yes.
But that is a strain on the heart for some people.
Slow. No, not at all. Not at all. Because while coming down, you are not lifting.
Ah, okay.
20 steps you are climbing up slowly. And in normal course, for heart, climbing up 20 steps shouldn't be. Rather, when we take, you have seen the treadmill test. Now, the typical treadmill test is not running on the belt. But earlier, we have seen that we used to keep such a stool, and person has to walk up, climb up, come down, climb up, come
Right,
down. That
right.
used to be the way how we used to take treadmill test.
I see.
10 minutes. 10 minutes of, climbing up, down, climbing like that.
Yeah.
So, for heart, it would be a good exercise rather.
And this is,
Only person who is in acute myocardial infarction or an attack, ischemic attack, that time we ask not to climb up.
okay.
Not an exercise.
So 30 minutes of walking up and down is the best for the knee also.
Yes. For the knee. Only thing is, if already there is damage, you have to be careful while climbing down.
Well, climbing down.
Climbing
yes,
down,
yes,
it's more vulnerable than climbing
Yes,
up.
yes.
Because climbing up would give some pain while lifting, and therefore you would be cautious. But
Last thing, what about shortness of breath when you're climbing?
no, that depends. You have to what we call adjust the pace.
Okay.
Adjust the pace. See, that's therefore if there are like 4-storied building, we don't ask the person to go to 4th floor and come down.
Oh,
We ask going 1 floor and come down, 1 floor and come down.
okay.
So it's a vast difference, you see.
Yes.
Climbing up 4 stories and come down.
Yes. Much more
Yes,
energy
yes.
is
Yes.
necessary. Huh? Okay. Well, this was wonderful. Thank you so much. Namaste.